Call to order the Monday, May 16th, 2022 meeting of the New York St. Louis County Board of Legislative Services Committee. I would ask for approval of the agenda, and I will make a comment about that after that agenda is approved. We will modify it to delete the number 3. So approving the agenda, motion by Mr. Reagan, second by
My name's Haggard.
my name's like, thank you. I really should. All in favor?
Aye.
Any against? Approval of the minutes of the April 18th Services Committee meeting by Ms. Byrne, second by Mr. Denisha. All in favor?
Aye.
Opposed? Carried. I would entertain a motion to amend the Services Committee agenda by removing number 3, the Shade Roller Property Development. Andrea Smith, Director of Planning and Development for the City of Augsburg. Is there a motion by Mr. Burke, seconded by Mr. Reagan? What we were informed, we being the board office was informed late this afternoon by Andrea Smith that she would not be attending this meeting tonight. And her reason for that was because she had spoken to the city manager and he did not want her to attend. I know no more than that, other than I made a phone call to her this afternoon on our way over. And she essentially said the same thing. That, city manager didn't want her to appear over there. But the original message came into the staff that took the phone by. And that was her excuse. And I'll do more than that. Okay. So if there's any discussion about the amendment, seeing none, all in favor?
Aye.
Opposed? Carried. We'll move to public health and Julie Munger.
Thank you. Hello.
I'll do the first resolution here for you, and then you can carry it on. How's that?
That sounds good.
This resolution is authorizing the chair to sign the emergency preparedness program contract for the public health department. Seconded, Mr. Rocco. Go ahead.
So this is a contract for our emergency preparedness program for the year of July 1st, 2022 through 2023. The cost is essentially the same, or the award is, it's $40 less than what we were awarded last year, but it does essentially remain the same. This grant helps us to fund our emergency preparedness coordinator and the events and supplies that are needed to have that program for different emergency scenarios this year, such as COVID, and some of the training exercises that we are required to run.
Any questions or any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a contract with the New York State Department of Health for the rabies program from April 1, 2022 through March 31, 2025. Moved by Mr. Sheridan, seconded by Ms. Curran. Go ahead.
So this grant, it's a 3-year grant, and each year it totals the $26,786. This grant has remained the same, and we use this grant to help fund our rabies program, so purchasing the vaccine and providing a post-exposure treatment and some of the cost for doing the specimen collection and testing.
Thank you. Any questions, comments? Seeing none, all in favor? Opposed? Carried. The next resolution is authorizing the chair to sign a contract with Jack Vineski CPA and Associates for preparation of the preschool supportive health services annual Medicaid cost report for the Public Health Department for the July 1, 2022 to June 30th, 2023 program year. Moved by Mr. Sheridan, seconded by Mr. Fay. Elaine?
Thank you. So this contract will allow us to continue contracting with Jack Vineski CPA and Associates. The cost for annually for this service is $4,500. This service, the cost has not changed since they've started providing the service to us, and it handles all of our supportive billing for our preschool program.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a contract with First Student Incorporated for preschool special education transportation services. Moved by Mr. Aaron, seconded by Mr. Perkins. Elaine?
So for our preschool program, we did put it out to bid. Again, we had one bid this year, and that was First Student. It is a 27% increase over the cost from the prior contract. This contract is another 3-year contract with the allowance for 2 one-year renewals if both parties choose to renew. We are working with the school districts on an alternative to providing transportation. So we started talks late last December and are in contract right now with some of the schools. So Brazier Falls, Edwards Knox, Governor, Hammond, Herman DeKalb, Lisbon, Morristown, Norwood Norfolk, Ogdensburg, Parishville, Hopkinton, and St. Regis Falls to provide some transportation services for either in-district students with classes, or if they already have a bus run going to the school district that the child needs to go to, the schools have agreed to do that busing. We have pending contracts with Hubleton, Colton, Pierpont, Messina, and Potsdam as well. And so that will be a service that we will be able to utilize in addition to the cost for First Student to help reduce the cost. For the budget part of it, we budgeted for the year $1,040,000. So far from January to March, we've spent approximately $187,000. And our estimated budget with the school districts and the new rates for this program is approximately $838,500.
Questions? Comment? Second.
Thank you, Mr. Chair. Jolene, so you contracted with these school districts and it's to replace this or augment it? Is that what I understood?
Yes, so some of the schools provide, not every school provides a special pre-K. So some of the schools we did a pilot with already just to see, what the feasibility would be. So say a child lives in the Potsdam area and goes to that special pre-K, they're able to just add that child in on an existing bus route to pick the child up and transport them to their school and back home. The issue comes in for some of these schools is if the student goes to Messina and the classroom is in Governor, they might not have a bus or a bus driver available to drive that one student from Messina to Governor.
Excuse me.
So-
So I guess what I'm getting at is it your plan to replace First Student by bringing on the school districts eventually, or are we still going to have to keep them?
It's to supplement. So
Okay.
the schools that have contracted with us, we have, each one's a little bit different with what they have for the existing bus routes and where they're going. So some schools are able to take on more with their students. It's going to depend on where the students are being transported to on what the school can handle. So they're not going to be able to do all of it. So we're going to be using First Student for the schools that can't do the busing themselves or bus specific children.
Thank you very much.
Anyone else? So I have a question, Jolene. So some of the school districts have taken it upon themselves to provide that service to those that need it, and which would decrease the number that first student would be responsible for. Is that accurate?
That is accurate, yes.
Is it also accurate that the costs for that program, well, it does appear to have decreased a small amount, is running about the same as it has over the past contract period?
So it depends. Every year it's a little bit different because students age in and out. So it's a 2 to 5 program, depending on when your birthdays are and what services that you need that the county offers. So in 2021, which is a low year for us, and part, some of that's due to classrooms being closed. We had our total cost for the year was $760,695. In 2019, it was $912,727. So it depends on how many students we have, how many, because we also do parent transport. So the more parents that transport their own child, we reimburse them. And that is a cheaper option versus first student as well.
Was an RFP issued for folks to respond to? In other
With
words,
the what?
did first student respond to an RFP by the county? Or how did it come about that they were chosen to do this, provide this service?
So during the RFP process, all of the potential transportation providers in the county were identified, and even bordering counties, and it was sent to them through our purchasing department. So I believe there was 8 businesses that the RFP was sent to.
How many responses did you get?
We had the one official bid. I know that multiple of them responded directly to purchasing, saying that they were interested in it. I know at least 3 responded directly to purchasing.
Thank you very much. All in favor? Aye. Opposed? Carried. The last resolution is authorizing the chair to sign an addendum to contract for software license and support with eClinical Works and for cloud hosting with eClinical Web for electronic medical records and practice management services for the public health department. Moved by Ms. Curran, seconded by Ms. Yata. Discussion.
So we currently use eClinical Works as our electronic health record system. Previously, they allowed us to have what we call a dummy license, so a separate license to bill under, as we have to have a medical provider's license to bill under while also billing under public health. They have taken away that for free, and there is now an additional charge to it. So our monthly bill fee will be increasing by $449 to just over $1,000. We are currently looking into other options that might better suit our department needs. This is a process that was started right before COVID, and we are now picking it up again. But in the meantime, we have to be able to bill for our clinic services, so our fee is going up.
Questions, comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Thank you very much, Jolene. I don't think that you have anything else, so do you?
Thank you.
Moving along, Jay Ulrich from Community Services. Evening, Jay.
Good evening.
First resolution is authorizing the chair to sign a contract with a supervising licensed clinical social worker for clinical supervision and modifying the 2022 budget for community services. Moved by Ms. Curran, seconded by Mr. Forsythe. Go ahead.
Yes, thank you. So we lost our supervising social worker about 6 months ago, and we have approximately a $30,000 salary lag in our budget because of that, and we have not been able to fill that position. So we're asking to contract, and it's a contingent contract, meaning if we hire someone, then the contract and those services will end. But we're asking to sign a contract with a local provider who has an LCSWR to provide clinical supervision to our 3 social workers that are on the mental health side of our operations. It's really best practice that they get this supervision in addition to really hopefully enhancing or helping with employee retention, which we are currently struggling with right now. So we would ask that we be able to sign this contract. It's for $100 an hour, which is actually probably cheaper than what that individual can make in his private practice. So it's not, it's a fairly reasonable price for this service.
Any questions? Any comments? Mr. Forsythe.
Jay, is there any problem with the union? You've talked to the unions on this and you're all set? Or do you need to?
That I am not aware of. I believe Ruth asked me to do that, and I did not reach out to Johnny as of yet.
Okay. Let's be careful with that. Thank you.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Next resolution is the mental health, well, it's not a resolution, mental health and addiction clinic update. Go ahead.
Okay. Start with the clinic updates. I think I mentioned in the last services committee that our call reminder system was down, and it has been down for approximately 45 days or so, perhaps even more. It's really hard to tell when that system went down until the client started speaking up. That system is now back online, but it did cause an increase in our no-show rates. Not all, but some of the individuals that we served got dependent on that system to remind them about their appointments, and when it went down, that caused a little bit of an increase in our no-show rates. In terms of clinic counselor visit averages, the average for this month is it's 585. And last month, I'm sorry, it was 584. So stayed pretty much the same. If you see, we only have 6 addiction counselors now. And that's because one of those counselors moved over to the mental health side. That person got duly credentialed and wanted to provide mental health counseling rather than addictions counseling. So the split now is 6 and 5 rather than 7 and 4. In terms of addiction services weighted face-to-face, we are at an average of 64.7. Last month, March, we were at 64.2, and in February, we were at 68.1. So it ebbs and flows a little bit. The one clinician on the weighted face-to-face that has a 48.4%, that's the clinician that's transitioning over to the mental health clinic. So we're still building that individual's caseload, so that affected the mental health numbers. So this month, the average was 68.52, rather than March being 71.4 and February being 75. So it dropped a bit because of that. In terms of the prescriber averages, we're down to 8.6. March, we were at 8.8, February 9.3. One prescriber was 7.2. Did experience quite a few no-shows, possibly because of the cancel or the call reminder system not being on board. We continue to have the wait list, the mental health side. We're anticipating that we can transfer most, if not all of those 18 people on the wait list to a clinician that transferred over. And again, on the addiction side, we have 16, but by definition, they're more, they have appointments, they're just more than 5 days out. So the 16 again represents the OASIS standard for a wait list. 5 days or longer is considered being on a wait list. So last month, there was inflated number for December numbers. I believe it said 14.71. That was incorrect. And I assumed it would have went down because of the holidays, and it did. That number is 684. And then in January, it went back up slightly. And in terms of percentage of billed and percentage paid, we're pretty much on par with what we've done in previous months.
Question by Mr. Reagan.
Jay, during the last update, we asked about the idea of some of these people who call in looking for help, who can't be seen immediately, about having them referred to citizens advocates until such time as we're able to see them. Did we pursue that?
We have on certain occasions, certainly those people that were more in distress than others. It worked in part. Some of them received, I guess, kind of more crisis-oriented services and were then kicked back to our clinic. So we do have a pending call with citizen advocates to try to discuss that process.
When you say kick back, what does that mean?
They referred them back to our clinic after they were seen.
Now, is that a good thing or is that?
Well, I think that they're still trying to, get some of the rough burrs off, in terms of operations and workflow and things like that. So again, we're going to have a meeting with them to discuss, exactly what their capacity is and really, what was the reason why they were kicked back when we did have the wait list. So, I don't believe it's a fault of citizen advocates at this point. It's just, it is what it is, but we did make that attempt.
I appreciate you making the attempt. What I'm wondering is is there a role to be played when you do have individuals in crisis calling for citizens advocates, even if after the crisis is over, that then they see your people. But in the meantime, during the crisis, when no one can see them, get them some level of help.
Correct. And we have done that, since the last meeting. Yes, we've utilized that service.
Thank you.
Anyone else? Mr. Burke.
Jay, is that callback system, is that part of our operations, or is that one of the contracts that we have?
I'm having trouble understanding you, Mr. Burke.
The callback, Jay,
Yes?
callback system that we have to remind patients, is that one of the contract services that we get from IMA?
No, that's a separate business entity. And we're actually in discussions with them to see if they will give us a discount on that monthly bill for that period of time. So we didn't have the service. We're hoping we don't have to pay for it because it was no fault of ours.
Go ahead.
Jay, could you give us an update on the methadone?
Yes. So in terms of the physical plant, the OTP, has been painted and the floor has been installed along with some new lighting. We have the temporary dispensing windows in place. When we ordered those windows, they said it was going to be an 11-week wait. So we got approval for temporary plexiglass to be put in the dispensing windows. The furniture is in the stands, or the what's the word? Not coffee tables, but the end tables are in as well. The computer in the pump has been synced and tested several times and also calibrated. We're continuing training for our prescribers for the use of the pump. We have 3 pharmaceutical companies, Cardinal, McKesson, and Bessie. We have those arrangements, so we are assured that we won't run out of medications. We'll be able to get the medications as we need. In terms of NCC, they are done with the wiring and putting up the sensors, the keypads, and the cameras. Now they're working on programming the system. And once it's finally programmed, then they're going to be doing some testing. So the doors was one of the things that we were waiting on. So the door installation is going to occur May 25th. And at that point, then they'll finish putting the door NCC will finish putting the door contacts on those doors. And then we're going to be doing testings on the security system the 26th and the 30th. And we're anticipating that the DEA is going to be on site the first week of June. So once we get the nod from the DEA, then it's just a matter of just subsequent approvals from Oasis and SAMHSA. We cannot order any medications for the OTP until we get the DEA approval and a DEA number for that clinic site.
Sure.
Jay, what's the status of discussions with Riverview Correctional Facility on serving that?
Well, we haven't pursued anything subsequent to the visit or the open house that we went to last week. The next steps to that would for us to write a formal letter requesting that we be the provider of choice for their MAT program, namely simply the methadone, not the Suboxone. They will be getting that on their own. It's my understanding that this, it has to go through the state process for approval, which may or may not occur. But I do know that the Department of Corrections would like the facility or the OTP closest to correctional facilities to be the provider of choice, rather than have to travel longer distances to obtain the medication.
So when will we be sending the letter?
Well, I think I'd like to have a little bit firmer open date. It's hard to request that when we're not open.
It's going to be a process with docs before anything is actually ever going to happen, but getting the ball rolling is the first step.
Okay, we can get that out then.
Just so everyone knows, and Jay, I want to thank you and your Director of Addiction Treatment Services. Riverview Correctional Facility expressed an interest in purchasing and receiving their methadone from our program, and Jay was good enough to come to a open house at Riverview that Chairman Sheridan also attended, and we had an opportunity for Jay and his Director of Addiction Treatment to meet the folks at Riverview, and they're very interested in doing business with the county because they expect that once they get going and we get going, that they will have a large demand for the service. And correct me if I'm wrong, Jay, I think Jay feels that that could be an additional revenue source for the county by cooperating with them. And it will, strengthen Riverview's position with the state Department of Corrections if they have a strong local MAT program and a strong cooperative spirit. So I certainly appreciate your efforts, Jay, and encourage you to move forward on this. I think, the superintendent of Riverview was very pleased that you came and feels that it will help strengthen Riverview's position long-term, which is always something that many of us are concerned about. We also, I reached out to Ron McDougall, who's on the Community Advisory Board for Governor Correctional, but at the moment, Governor Correctional expressed that they're satisfied working with Credo. They will talk to Riverview and decide among themselves whether or not Governor feels they need to participate in this or not. But I wanted to make sure that Governor also had that option available to them if they were interested. But I do know Riverview is very interested, and Chairman Sheridan also, thought it was important that we do everything we can to keep Riverview strong and in compliance with all the new state mandates that are coming down.
Mr. Akers, and then Ms. Becker.
Yeah, mics aren't working, Ruth. So anyway, Jay, how would that be accomplished? Would inmates have to come to our dispensing unit, or would we have to set up a separate dispensing unit at Riverview?
It's my understanding that they would actually use correction officers to transport the medication from our OTP back to the correctional facility. And whether or not they have to have a nurse on that travel or not, I don't know. I've heard that Docs is not going to require that, or that the state is not going to require that. I'm not sure how the DEA would weigh in on that, but because typically for us, we would have to have a medical staff along with the sheriff's department to transport the medication to the jail. So I'm not exactly sure how that is all going to play out. They do have approximately 350 inmates there, and they felt that possibly half of them might like to participate in this program. Whether that would be methadone or Suboxone, it would be hard to tell. That would be based on the assessment done there, I'm assuming. But that's a lot of dosing. We're looking into seeing if either an LPM or a medical assistant can do some of the dosing for that purpose in the future as we expand our own services within the county for the general public. Right now, we have 19 individuals flagged for the methadone medication. We have about 30 Subutex individuals or patients that we will probably be dosing that medication out of the OTP. that might not necessarily be daily dosing. But we've had difficulty with the pharmacies getting the Subutex, so we feel that might be better to just do that through the OTP, which we would be licensed to do, and we would be able to keep that medication on site. And then we have about 5 Suboxone patients that would probably benefit from some daily dosing as well. So, and that's before we even start looking at individuals that don't currently participate in our clinic services.
Well, okay, so that's a good thing, would make I think the information that we've received in the past is that really need to be doing about 100 doses a day to be somewhat in the black, if I recall. The doses determined by body weight, medical history, how are they determined? Is it one set dosage, like 5 millimeters or whatever to somebody, or, how is that done? I'm not aware of.
I think the average dose is around 40 milliliters, but that's done through the assessment of our medical director in terms of what the start dose would be, and then that would either be titrated up or down depending on subsequent psychiatric assessments of how the individual is doing. So that's a case by case. I'm not aware if it has to do with body weight. It might be the nature of the addiction, but I can check on that.
But I think if there's any kind of variability, I think just the margin of error, we're transporting it, and I don't know if it has to be refrigerated or what, actually to the jail, and all those individual dosages, there'd be problems there as far as the administration of it.
Well, all the doses will be marked for each individual client. I mean, that's part of the, like, even take-home doses. There's seals that are put over each bottle with the patient ID and the dose. I mean, it's very much like the same information that you would find on a prescription for an antibiotic that you would get from the pharmacy.
Thank you.
Second.
Thank you, Mr. Chair. Jay, kind of a two-part question. A quick update on the mobile unit, and when and if we ever get that, could that be something that transported the medication?
Well, we would have to retrofit that in order to use that for methadone transporting or methadone dispensing. We did not spec that out at the time because it was not something that was sanctioned by the federal government, which has since changed. So for us to go back and retrofit that during this build process would have been, number one, very expensive and more than the grant that we're paying for it out of would allow for. And also there would have been further delays on the build. So we did not go that route. We have applied for a $250,000 SAP grant, and we are thinking or considering applying for a COSAP 2 grant, which is, this one was 900,000. That one is up to 1.3 million. So, I mean, that's a possibility of looking at that moving forward, but that's not, in the immediate future right now.
Jay, do we have any timeline on when we're going to have that vehicle?
Well, they keep promising that they will get it built before the due date, which is the end of September. And we keep, I know Stephanie Kerr from purchasing reached out to them, with, a pretty direct letter or email, stating our concerns as have we. So they're aware that it has to be done by the end of September, and they continue to assure us that that's possible. So, it is a little bit of a white knuckle, and it's one of the several things that keeps me up at night. So, but I'm hoping this is going to work out. So.
Thank you.
Well, Jay, I have a question. You said that the DEA was going to be there in June.
All right.
What, final inspection?
Yes, I mean primarily for the security system. So that's why we're going to be testing it twice, because they've already made it known they're not going to be real happy if they get here and it's not working. So, yeah, I mean, that's, and they'll look at.
Final step before being able to operate.
Well, once the DEA approves it, then we have to kick it back to both Oasis and SAMHSA for their approval. But it's really, they're really awaiting for the DEA. And once that occurs, I mean, we have preliminary approval already from Oasis, and we're in contact with them very frequently, you know, about where we're at in the process, and also for some technical assistance as well. So.
Will the approval or disapproval be given upon the completion of their visit in June? Or is there, you know, a 2-week waiting period, a month, or whatever?
Well, we have been told that once we have the site visit from the DEA, there may be a 10 to 14 day lag for approval after that. And then Oasis will also send someone out to do a physical plant inspection before they give their final stamp of approval, because that's really the only thing that's lacking from Oasis.
Realistically, when would you expect to be able to hit the road?
Well, we're still hoping that it's going to be sometime in June, howbeit it might be late June. I mean, that's optimistic, but once you get the regulatory agencies involved, we're really on their timeline once we have everything done on our end.
Any other questions? Okay, thank you very much. Unless you have something else.
Well, I just want to just highlight, or not highlight, but just let you know that, you know, we're still looking for a nurse for the jail when we go live with the MAT mandate. We're looking for a nurse to backfill the clinic manager / nurse manager position. So that's 2 nurses. We're looking to backfill a KSAC counselor position, addictions counselor position, as we lost one to the mental health clinic. We're still looking for a senior chemical dependency case aide. We're still looking for a supervising social worker. And we're still down one, either licensed mental health counselor or licensed master of social work. So that's 2, 4, so that's 7 positions. So that also keeps me up at night. Just want to let you know.
Questions or comments? I would ask you, how long can you keep going without these 7 people, 7 positions being filled? And do the job that,
Well, I mean, it's really depends on how much of a hardship it is to the existing staff to do the work that needs to be done. So, I mean, we can go a while, but we do have one person that we're going to be interviewing this week for possibly a part-time nurse position. That individual worked in addictions rehab, worked with mental health, and right now is just doing per diem work for another agency within the county. So we're hoping to bring her on board and possibly over time, maybe see if she would want to come on full time. We don't have candidates at this point for the other positions, but I mean, we'll make do. You know, we'll do what we have to do. I mean, we're also looking into whether or not like a medical assistant and or an LPN can help with the dispensing. We don't have an answer on that yet.
how long have these positions been vacant?
Well, I mean, the two RN positions are fairly new, because like I said, we had one person that moved up to the clinic manager position who was a nurse for our clinic, who also had director positions in other agencies from prior employees. So she was really kind of a shoo-in for that position. And she's very much stepping up. So that's only been several weeks. The mental health counselor on the addiction side, that's been 6 months or so, 5 to 6 months. I mean, that's not as critical as some of the other positions. The senior chemical dependency case aide, I anticipate that we'll be able to fill that. I'm not too worried about that one. Supervising social worker, that's an LCSWR. They are hard to find. So that's why we're moving into a contractual relationship with that, at least have the supervision covered. And then LMSWs and LMHCs, we need one of those for the mental health side. You know, I mean, it's hard to say. I mean, we have 2 fairly new clinicians. One came from Colorado and the other from Texas. So, you know, it's really just, you know, synchronicity and timing to find somebody that wants to move to the North Country.
Mr. Akers, question.
So Jay, I think it's a perfect opportunity. Administrator there for Claxton Hepburn announced that they're going to be laying off staff 4% at Carthage, Claxton Hepburn, and actually I think Lewis County Hospitals will be a prime time to actually reach out to those individuals who are losing their jobs for these positions.
Can you repeat that? You said Claxton?
I believe it's Claxton Hepburn and Carthage, and I believe Lewis County Hospital are all, there's going to be, there was an announcement last week of 4% layoffs. So I think some of those people that are being laid off would fit the bill for positions here for the county, particularly those that are working now at Claxton Hepburn. So reach out to their HR department or find out who these individuals are that are going to be losing their jobs, see if they fit the bill for these open positions of yours.
All right. We can do that. Thank you.
Well, I think we'll find that the hospital administrator for Carthage and Hepburn limited those 4% layoffs to office person. So that would help. Jay, if there's nothing else, thank you very much.
All right. Thank you.
Moving along to social services, Joseph Siebert. Good.
Good. First, we have a resolution authorizing the chair to sign a renewal agreement with Securitas Security Services for the provision of security services at the Harold B. Smith Building and modify the 2022 budget for social services to reflect as much. This is a contract renewing it for 4 years.
Let's get it on the paper.
Sorry.
On the floor first. So the first resolution, as Joe so kindly read for me, that I will read again, is authorizing the chair to sign a renewal agreement with Securitas Security Services for the provision of security services at the H.B. Smith Building. Moved by Mr. Fay, seconded by Mr. Sheridan. Go ahead, Joe.
My apologies, sir.
No problem.
Jumping on there a little bit. So this is a 4-year contract that we're requesting to sign with Securitas to continue to provide the services of our 2 security guards that we have there, that have been there for some time. Based on the New York State contract prevailing wage schedule, we are asking to modify the budget $21,000 to accommodate this new contract, new wage scale, and continue to provide the services that we need.
Questions or comments? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution is modifying the 2022 budget for social services for office equipment. Moved by Ms. Curran, seconded by Mr. Smither. Go ahead, Joe.
This is an initiative to upgrade the desk phones. There were available funds in our MMIS account, but it's lower than expected cost to cover this project. It is necessary, however, to modify the 2022 budget for social services to reflect those cost differentials.
Questions or comments? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution is modifying the 2022 budget for social services for the Safe Harbor program. Moved by Ms. Fiaco, seconded by Mr. Burke. Go ahead, Bill.
This is an updated budget request. We had some additional revenue for our safe harbor project. So we are just requesting the modification of the budget to reflect the changes. So we can accommodate the increased revenue and the increased expenses for the projects that we've got going.
Mr. Hager.
Mr. Seaver, can you tell us what the Safe Harbor program amounts to? What is it?
I'm going to ask Ms. Grant actually to discuss that. She was more involved in putting the program together than I was.
So the Safe Harbor program and grant is for education, information, and we also purchase items that help individuals feel safe when they're in a situation where they may be being interviewed or in potentially an unsafe situation such as cell phones, items like that. We work collaboratively with the Youth Bureau, and I believe that you may see one of our advertisements on the side of the bus regards to education for trafficking.
You mentioned Safe Harbor for interviewing for being interviewed or?
Sure. So when there may be an incident that occurs where an individual or a child has been potentially trafficked, or there may be a criminal situation, the individual may be brought someplace to be interviewed, and there may be items that might be purchased to help make them feel more comfortable or safe in that current situation. Like I said, we've purchased cell phones, for example, for folks if they have a way to stay connected. If they're not having a way to be connected to folks. We also provided Zoom and in-person educational programs in the community for anyone who wanted to attend.
And how was the program administered? Are you going through schools or it's just individuals that you come in contact with? Or are they referenced to you by law enforcement or?
It's individuals that may be identified through the youth advocate program. They may be identified through the Youth Bureau, or they may be identified from within folks that we work with through social services or the general community.
Thank you.
Well. Mr. Hager.
So how many kids are you guys seeing who have been involved in being trafficked?
Well, social services doesn't necessarily see these folks. We're not the agency that they're referred to when they are, when an incident takes place or occurs. It could come through law enforcement. It could be referred to Child Advocacy Center. We do have a program that was instituted so that any child that comes into involvement with social services is screened through a screening tool for potential trafficking, and then they would be referred for those services. So I
And
don't have an exact number of those folks.
does anyone keep track?
Yes, we could, I could probably get that number for you through collaboration with the Youth Bureau and also looking at our reports that we provide.
Okay, thank you.
What else? Mr. Hager.
Heather, is this a St. Lawrence County program? Is it a state program? Is it a federal? How is this, where does this begin from?
So it is a grant through New York State, and I believe that most, if not all counties, excuse me, receive grant funds for Safe Harbor program.
So it's a state program through social services then? Is it through the Office of Children and Families, OCFS, or not?
Yes, through the Office of Children and Family Services, and when it initially started in our county, I believe it was awarded directly to the Youth Bureau, and then the Department of Social Services became entrusted with the grant.
Thank you.
Questions or comments? Seeing none, all in favor?
Aye.
Opposed? Here,
Point of order, Mr. Chair.
yes, ma'am.
I had a question about the previous resolution, but I didn't get my hand up fast enough.
This is the vote.
I'll work on that.
We'll say part of it.
The time, you can always invest in it.
Okay.
We're going to move on to the social service statistics. Grant.
Yeah, we'll try to get back to our normal in a bit. Thank you much.
So the following are the services data report for April of 2022 for St. Lawrence County Department of Social Services. As usual, we're going to start with Child Protective. We received 180 new referrals for Child Protective investigations for the month of April. That was an additional 376 children that we're working with. A reminder that the referrals or new reports for Child Protective investigations occur when a child or children are suspected to have been abused or maltreated. Child Protective Services is the investigative response to allegations called in through the New York State Central Registry, who accept processes and then pushes the referrals down to the local county. If we look at the closed case percentages for our indicated unfounded or family assessment response, you'll see a slight increase in our indicated reports from last month from 7% to 11%. However, it's still well below the state and federal average of about 15 to 16%, which we do anticipate and expect with the increase, with the change in the state central registry reform that changes our indication from some credible evidence to a fair preponderance of the evidence. You'll see that the FAR percentage decreased slightly from 16% to 14% for the month, and the unfounded decreased as well, 77% and 75%. So overall, again, we're going to be watching that indicated rate, which is currently for the year 16%, but we do expect it to drop. We looked at the 7-day safety assessments that are inputted into the connection system for the month of March, because we do receive the state reports about a month late. So this report is for March, 96% completed, 97% last month. A reminder that this data is, like I said, for March of 2022. Since May of 2021, St. Lawrence County has been at or above the New York State average of 90%. So moving on to average CPS caseload, reminder, New York State Office of Children and Family Services recommends monitors caseload that have 15 or more investigations open. The average caseload, as you recall, has remained pretty steady between 26 and 27 investigations since we started providing these reports. However, during the most recent quarter, we have seen the average caseload decrease twice now to 24 cases per investigator. This decrease from 27 to 24 in the last month is a positive indication that the workload may be adjusting and stabilizing with the addition of new staff, and we somewhat improve the retention of current staff. So the total number of cases or investigations that are open is down from 688 last month to 660. 138 cases or investigations were closed in April of 2022. And then if we move into the individual units, the net changes per worker in investigations. This is considering both the new referrals that they're receiving and the cases that are being closed. You'll see the majority have saw a reduction in their workload. And you'll also note that in the 0 years or the new individuals coming on board, that they are starting to receive cases in many of the units, and some have even moved up to full caseload. So if we move forward to unit 5478, that is our training unit. I just wanted to make a note that we did have one resignation, employee 7636, who was previously noted in that unit. So that individual actually will be leaving us on May 27th. And again, you'll see a couple of new staff that are processing full workloads now that they've completed their training and have moved on. So they're probably closer to the end of their first year of employment with us. And unit 6035, just wanted to make a note that this unit has seen an increase in the number of investigations that have required court involvement, which is a much more time-consuming and in-depth process. So you have a mix of some that have been able to close and some that have seen a slight increase in their workload. Unit 7255, almost every caseworker has a net change that reflects a decrease in the overall cases. Again, we're noting some of those new employees that are reaching their year of employment and are having full caseloads or some slightly beyond full caseloads. And looking at the training period, I want to make a note that the first individual, you'll see an extended training period, and that is because New York State Office of Children and Family Services, as we've moved out of COVID, have started to do in-person trainings again. So that has unfortunately extended the training period, as we have to have people go to Albany for in-person training as opposed to virtual only. The bottom two folks actually were done this past Friday. They completed their training Friday the 13th. So this week they will start taking investigations and they will move into one of the units. So they will be within one of the units for next month's report. An update regarding Child Protective Services staff. Again, we had one resignation for May. And that person had actually been off on medical leave for a while. We have 4 staff starting on May 31st, 1 on June 14th, and with the exception of the newest resignation, we will be at full staff in Child Protective Services once those individuals start. So June 14th, with the exception of the most recent resignation. That's just a huge accomplishment. So we're happy about that. If you look across the bottom, you'll see the number of cases that were closed by individuals. The individual with the most closed cases, I will again note, this is the senior caseworker that I mentioned to you before that has been helping us to really process through a large volume of cases that are left behind by some of the folks who resign and leave behind high caseloads. So that's been a tremendous help to the other investigators within the unit as well, not have to take out those additional cases. So if we move into foster care and preventive services data for St. Lawrence County, we are reporting under 300 children in foster care. We have 296 children as of the end of April that are in foster care or in custody of the Commissioner of Social Services. Within that 296, we have 15 that are home with parents on a trial basis, and we have 168 youth that are placed in kinship or significant relationship homes. So 113 children are actually placed in either certified foster homes, residential settings, or other non-relative placements as of the end of April 2022. The net change is because we saw 11 youth exit foster care and 7 enter for the month of April. Our average number of children in care is continuing to trend down to be more in line with our 2019 averages for children in care. This is a marked significant positive improvement over the past 2 years. As we look at our average days in care, we continue to still see a high number there, still struggle with the number of days in care. We have 767 days in care overall, and removing the children that do not have an adoptive resource, which are our long stayers, our youth without a resource, and our independent living youth who are 14 or older who do not wish to be adopted. The average length of stay is 719 days. As we move into preventive services, preventive services are the home-based services that we provide to families to help children from having to be placed outside of their home. By working collaboratively with the families to identify both natural and community-based resources in order to reduce and alleviate risk factors in the home, so that the family can remain intact safely. These services can be voluntary, however, most are court-ordered cases. The average caseload is 12. Reduction from 13 last report. As we move through each of the units, I'll just make a note that the first unit has one individual starting on May 31st. That's the foster care preventive unit. The second unit is also a foster care preventive unit, and employee number 8511 is actually in one of the bottom units, should be in that unit. So we're going to make that change for next time. And we have one that will be completing training in May as well, that will be joining that unit. The adolescent unit, unit 2942, specializes in services, programs, and skills to address the needs of adolescents in the child welfare system. We have one individual in the training unit that will be moving into that foster care preventive unit. And the fourth unit is also a foster care preventive unit, and 2 individuals will be added that are currently in the training. Unit 3660 is our adoption unit that also carries some foster care and preventive cases as well. And we have a couple of folks who will be transitioning out of that unit and one that will be transferring in, as this unit has been identified to potentially go to the Ogdensburg location. Our home finding unit that trains, certifies foster homes has seen, we have one individual who's actually in training in that unit to become a home finder and provide the education and support to foster parents. So that's why they have the lower, they only have a couple homes that they're working with. So they're providing support services for foster parents and completing the training so that they can also be responsible for certified foster homes. We look at our trainee period. We have an individual in red. That is because that individual did not make it through the probationary period. And we have the extended period of training for the person at the top. And that is again because New York State has shifted to in-person training, and that has extended the training period. The bottom 3 individuals completed their training May 6th. So they have been moved into units, and you'll see that reflected in next month's report as well. So we have 4 vacancies in foster care preventive, and we have 1 individual that will start May 31st. The test for caseworker is being given this Saturday, the 21st, and 4 out of the 5 caseworkers that we hired are provisional. So hopefully there will not be any issues there. You'll note, as usual, cases being closed, very minimal, typically because these are court-ordered services that are extended 6 months to 12 months at a time, and there aren't typically a lot of cases opened or closed within a month period. It's pretty steady. As we look at the adoption activity, we had 3 children adopted in April. 56 remain free for adoption with a resource. 13 are free without an identified resource. And as of today, there are 10 adoptions scheduled for May this week, with the adoption day event taking place this Thursday. 9 of those children will be adopted. We have 2 adoptions scheduled for June. And there are an additional 20 packets pending with the court. So the adoption unit as well as the legal unit have been busy, very diligent in filing timely for adoptions to take place. we look at the foster care placements overall. Again, since it began, family first federal and state goals and guidelines that continue to be met by St. Lawrence County. The goals, as you recall, are to be less than 8% in institutional care. We are at 6% for St. Lawrence County, and to be greater than 50% for our kinship placement, and we're at 57%. An update regarding DSS employees as foster parents. Currently, we have 4 DSS employees that are certified. This is the result of 1 employee choosing to close their home and 1 employee transferring employment. There are a total of 0 St. Lawrence County youth that are placed with DSS employees at this time. And we have 1 out-of-county relative placed with one of our certified DSS employees. So just before moving into the eligibility data, I want to provide the board with just a few statistics from our employment unit. So our employment unit wanted to share that they consist of 5 employment counselors, 1 employment coordinator, 1 counselor, 1 clerk, and 1 supervisor. Each counselor works with approximately 75 participants. The unit considers the services they provide to be seeds or building blocks for helping individuals to overcome barriers, problem solve, prepare for employment opportunities. Throughout the county, the St. Lawrence County employment counselors provide services that help to break or interrupt cycles of generational poverty. The services, along with support and encouragement, empower individuals to take part in educational and employment opportunities that ultimately increase one's capacity for self-sufficiency. As COVID restrictions are changing, the unit looks to increase engagement processes in the community and help local employers who have reached out to find for assistance looking for employment to fill staff vacancies throughout the county at their businesses. In sanction savings, the employment unit has cost savings so far for 2022 of $45,679. And in 2021, the yearly savings was $111,624. So in looking at the eligibility program data reports, I'll just summarize to say that we have seen an increase in SNAP medical assistance in key cases and a decline only in the temporary assistance cases. However, I will defer to head social welfare examiner Karen Durham, who's going to present next to talk about eligibility programs.
Question, Ms. Haggard?
Thank you, Mr. Chair. Ms. Rand, on page 4 on the children care, the 4 lines underneath the 296, we want to add up to 296, or is that the way that I'm trying to understand this grant?
You can speak to that if you want.
Yeah, that would be great.
So as it's explained to me, the 21 and the 15 are a part of the total in foster care, the green line. So if you total the red line and the green line, you actually will come up off by 1, 296. The red line and the green line are the total. If you look at the institution, home on trial basis as part of the foster care number, you come to that total. Because there are categories underneath.
Okay, so I added them up.
Yeah. Yeah. Yeah.
Thank you.
You're welcome.
Thank you very much.
What else? Sure.
The training that has to be done in person. Who needs the training? Do they stay overnight?
So arrangements are made, they stay down there, and I believe right now the in-person requirement is 2 separate weeks. And it's, they would go down for 3 to 5 days, return, and then go down for 3 to 5 days.
What's the virtual training?
The feedback that I have received is that the in-person training is more effective when it's done at the beginning. The way that things have worked with COVID is that we have brought folks on board. We have done virtual training they have done trainings with the staff. So they've gone out with some of our senior staff. They've done hands-on training with some of our senior staff, and that has been very helpful. So I don't think anything can replace the on-the-job hands-on training. However, the settings that they use for the in-person training, they set up courtrooms, for example, and people can practice testifying. They set up home visits. They have an actual entire facility that was remodeled to be able to enact situations that you may encounter.
You think that the in-person training is worth the investment?
The in-person training is not an option. It's an OPFS requirement. Is that what you meant?
I understand that. I guess I'm just wondering, you know, if it's 4 hours trip down, 4 hours trip back, it's cost to us. And I was just trying to get some sense of whether it's a critical piece of the training or could the virtual device.
I don't think anything replaces an in-person training. I think the feedback that people have given is that although it may be difficult and people struggle sometimes with being away from home with responsibilities that they have, that's something that can be replaced virtually in training.
The employees that left or is leaving. Any sense of why they're leaving or long-term employee or short-term?
A longer term, I would say 4 to 6 years, somewhere in there, and burnout. But they're remaining in the county.
Who else? Mr. Gregory.
The, any feeling for why we're seeing such big drops in the safety net folks and the temporary assistance folks?
Are you talking about the bottom part?
Yeah.
Sure.
Okay.
So the drop, you're asking the drop in the temporary assistance cases
And the safety net.
and the safety net. So the drop in the temporary assistance cases, I believe it was because COVID was done.
Because why?
COVID was ended.
What does that mean?
That means that we're not automatically placing them on us.
Pardon me?
There's not as many TA cases coming through.
There's not as many what?
Look at the mic down there.
It is.
So when the temperature
32. Okay, so when the temperature is below 32, we automatically place the diesel and more to make those payments to pay for those homes. So that is part of the explanation for the drop in the temperature.
So what happens to someone who presents himself as homeless after the temperature rises?
Who determine whether or not they're eligible for temporary housing. There's multiple eligible statements, whether or not there's
Speak into the microphone.
whether or not they're complying with the eligibility requirements.
Okay, and the, so what happens to them if they don't meet?
Usually they have they go back to couch surfing or find a phone number that they can say.
And the safety net,
I really did not do an analysis of that, but I.
Would you?
Read it back to you.
Thank you.
We'll do that.
Sure.
Thank you. Heather, so we have 180 new cases. If I'm correct in this, and actually out of the 180 in child protective, 16 of those actually were indicated. Front page there. Am I reading that correctly? Is that-
So the way that it works during the month of April, we received that 180 referrals that you're talking about. There's 60 days to investigate those, but those wouldn't be closed until May, June. So the data here with the 16 and the 11% is referring to cases that would have come in, say, 2 months prior.
Okay, so back in February then,
Right.
essentially. Okay. And that's normal. I mean, so don't you have like 24 hours to actually, somebody makes a call to actually respond in some manner?
Right, so you have 24 hours to assess the safety of the children that are identified in the report. And then the 7-day safety assessment, that's documentation that goes into the computer. The actual investigation is a collaborative process with the family, also a collection of information from all different sources, and that is the 60-day process.
So it's not taking 60 days to answer all the 180 cases then, or will it? Because you're getting a hotline, right? So if I'm mad at my neighbor and I said I saw them beating the hell out of their kid here and left them overnight in the ditch, then you go out and investigate within 24 hours and you determine that it didn't actually happen. You don't take another 40, 59 days to close that case out, or do you?
No, you're right. There are cases that can definitely be closed prior to the 60 days. The requirement just isn't going out to see whether the incident occurred. You then have to see every parent. So even if, say, parents are split and you're able to find out it didn't happen, you still have to make contact with other parents. We do a global assessment, so you're making contact with the pediatrician or the school or providers that are working with families so that you get a well-rounded picture of what's going on in the home and you're not missing anything. So it could definitely be less than 60 days, but there certainly are cases that could involve work, could involve other requirements that may make you exceed the 60 days as well.
So the other thing on these cases closed, where we mentioned about the court-ordered systems, that sometimes they're delayed like 6 months. Why is that? It's got to be hard on the people that work for you or work for DSS, and it's actually hard on the people, the families themselves. They're looking for a determination.
Right.
Why is that?
So the determination regarding any child protective report is complete. The 6 months or 12 months is in regards to if a case is taken to court, the court order services over the family. The court will extend that order or orders of protection, orders of supervision over the family for 6 months to 12 months at a time, for them to complete or demonstrate that they're able to benefit the services.
Well, sometimes they're even looking for a decision, right? Determination.
Well, the child protective investigation would have had a determination. The court process, and Mr. Watson would probably speak better to it, but the process would be that they would have various hearings, and hopefully there would be a determination, and then there may be orders of protection and supervision that extend to allow the family and the individuals to seek the services that they need.
It just seems very difficult in a custodial hearing that when you're going through the process to determine who's going to have custody, and then when the court decides, okay, we'll reconvene in 6 months. It's going to be hard on everyone, so it's hard on the families. But you don't have a role in that. I mean, that's the family court.
That's the court's calendar.
Mr. Denise.
Karen, question for you regarding capabilities. Do we have any kind of outreach program for vulnerable parts of our population, or is it all driven by them contacting?
No, we absolutely do have outreach. We contract with the Office for the Aging and also with neighborhood centers. All of those in CUP, and they all have applications. So that anybody going into a neighborhood center, for instance, in the food banks, we also make sure that the schools do have the information. Yes.
Yes.
Not this past winter, but the winter before. There was one of my constituents was heating their home with their oven and a chicken coop heater and some electric heaters. That furnace was not functioning. Was not able to go anywhere. Contacted DSS a number of times. I spoke with Jason Fotenhauer. Thankfully, he was able to do something. This person was a safety issue, child at home, and could not get any help.
Usually in those situations, would have been offered placement. The thinking program will place individuals to keep them out of a dangerous situation.
So as far as repairing your,
We do our best with the resources that we have. And if the furnace can't be replaced timely enough that they are in a situation where they're heating their oven, we absolutely offer placement.
and go ahead, one more. Keep eligible. Someone is deemed eligible for. And then I'm not sure if the credits or they end up getting fuel is paid for by heat, and then they're notified that, oh, we made a mistake in their calculations. You're not eligible, so you need to pay the money back. Wasn't their fault. They didn't make the error. There's someone else other than the folks that applied for it made the error. So now they couldn't afford to buy it again. So now they're being told, hey, you got to pay it back. I don't understand it. That does not seem right.
The state program, whenever there is an error found, the state requires and the federal government requires that those funds be determined as an overpayment. And that person will be billed for whatever over issuance of funds that they receive. So that is program rules, they come down to the federal and the state government.
Okay, Mr. Forsythe.
In regards to that instance, they filed that. The heat benefit, what's it a lot first time? Roughly.
So I don't do it every day. I actually want some people work with. So currently, a regular heat benefit for fuel or non-wood is $675 to $751. A regular wood benefit would be $525 to $601. And the regular benefit for St. Lawrence Gas, Sealand Electric for the land or more is $350 to $426.
Okay. So I'm hearing stories of fuel, $6 and $7. That would be 100 gallons. We're not gonna have to worry about so much now, but is there any conversation going on about how, that's not gonna get anyone anyway?
So this year, in the past 2 seasons, the state is issuing, first emergency, second emergency, third emergency. So currently, although the regular heat, season has ended, the first, second, and third emergencies are still available. Way up until August 31st.
And people that receive the heat benefit know about this automatically, or they get communication from that effect, or how do they?
Yes, and we do lots of advertising and make sure that all of our community partners are aware that anybody that is in an emergency situation needs to know that heat is still open.
Are there any other questions for Heather Rand?
So Heather, how many openings do we have for caseworkers right now?
So with the resignation from CPS, that is 1. And the 4 vacancies in foster care preventive. I believe 5.
Last month, has there been any effort? I brought up the idea that there's a pile of North Country residents that are graduating from SUNY Potsdam with childhood education, and to be a caseworker, they just have to have a 4-year degree. Really doesn't matter what that degree is in, but I wonder if there's been any kind of outreach. You mentioned a test is this Saturday, so maybe a little bit late. Any outreach to new graduates that maybe not have a job, maybe do not have a teaching job, elementary job?
Yep, so we participated in one of the career fairs.
Oh, great.
Recently, and we also are reaching out to, I think there was a suggestion to reach out to the career offices at the university. So we're also in the process of doing that for our staff development office, who works with our interns who come in, and we've had interns from every one of the universities here.
So too early to tell about any results, but
Too early to tell, but we are trying to get the word out more and participating in that. So at the career fair at the university was hopefully very helpful.
but I can remember reading where certain graduates at Waddington, the school that I'm associated with, were going on to SUNY Potsdam. There was about 10 kids that were actually going into childhood education. So it just like a kind of light bulb went off. There must be other North Country kids that are, want teaching jobs in elementary. There may not be the openings. I mean, typically when I was on the school board at Mount Waddington, we would have 80 to 100 applicants for one elementary position. I realize things have changed now, that the turnover is greater. People are just changing jobs, but there's a lot of applicants that need good caseworkers.
Those are good ideas for follow-up.
Mr. Reagan?
I don't. No, I was.
Mr. Burke?
This follow-up, what Larry said, and Dave said. What are you seeing as far as the needs for the front line? What's been meeting around? So I'm wondering, what's at the front door and what gaps there?
Oh, that's a big question. Home-based services, home-based clinical services. I know that we are working hard on trying to identify some programs that are approved through Family First for additional funding, so that we can bring those programs to the families that we work with in St. Lawrence County. So there are lots of needs that are out there, and I would like to see an increase in the number of families that we work with preventatively. So the number of people that we receive voluntary calls from that are just looking for some education, some support, some assistance, and so that we can help prevent the calls coming in through the registry and potentially kids being placed outside the home. And I think one of the key pieces are the ability to have in-home clinical services or enough, I think you reported, some folks on the waiting list, that's just one provider within the county, so services available for anyone that needs them for county dependency, mental health issues, sex abuse issues, sex issues.
David mentioned that I crossed to that as well. It's, we all sit here and wonder, how difficult is this? Challenge, I mean, get anecdotal information, but again, being on the front line, better view of it.
I mean, I think Karen can tell you access as well, but poverty continues to be the root of a lot of issues that we see. Poverty that exists within the county. I think employment brought it up when they asked me to provide information that working with folks was a help to break the cycle of generational poverty. You might see that in your eligibility programs as well.
Yeah, just the number of cases in April is still. Assistance program. It really there.
No. What's up?
See this, just started seeing it the last couple of weeks, the elderly guy and his elderly daughter. About line services in the standard. Do we have such services? Not so much for mental health, but just a live, to get by. Help them walk, help them take a shot. Is there services available?
Personal care providers, it's hard to find providers.
There's a need. Use more.
They contract for those services. There's agencies that provide those services, and I think the message that has been received is that there continues to be a shortage in employees, people available to do those services.
And I think that's across the country. The certified nurses assistants are paid minimum wage.
Yeah. It's a pretty touching commercial, it's big.
Thank you, Mr. Chair. I've asked Mrs. Doyle to help me out here, but I'm pretty sure we saw a resolution from NISAC that asked for the pay for people who go into the home health aides to be raised because of this problem. They don't have enough people. And I'm not sure, I don't think we included that in our group of resolutions, but I do recall seeing it. It is a huge problem throughout the state and the country. As well as trying to entice care providers or specialists like OT and those kinds of things. There was a resolution out there that didn't make it through committee, but it was for a tuition reimbursement for those people if they serve a certain number of years or whatever, because we're just not getting that kind of talent up here. People from Nassau County were talking about the jerk. How many millions of these people are coming in looking for jobs? Well, send them our way because we really don't have them. Thank you.
Sure.
So, okay, probably been asked 100 times already by somebody, but the baby food, the baby formula situation. Are we seeing where people can't have their big checks where stuff like that's not available to them in this county?
I don't have any personal knowledge of that. I don't. We haven't heard that at the agency. I would imagine that they would probably report that directly to
not aware of any issues within foster care. Nobody is reporting that any of the children aren't able to catch the WIC check, or that foster parents aren't able to find the adequate formula that they need for any use.
My concern was simply if there's not enough formula and it affects people, and then they end up in the ER and something's going on with their kid, your calls are going to stretch it.
Any other questions? Next one. Go
Just a
ahead.
couple of comments to answer Mr. Forsythe's questions. There are the CHAHs, the Certified Home Health Agencies, Potsdam, there's one, and United Helpers got into it. And the goal is actually keeping people in their houses as long as you can. Because when these individuals get into their nursing homes, they're losing money. The reimbursement from the state is not keeping up. And on the fuel part of that list, for those that are looking for assistance, if you take 2 years ago, diesel fuel was $1.40, it's now $6.40. So $5 full winter, my old house, we burn about 400 to 500 gallons per month. So increase of $2,500 for me. So there's gonna be plenty of people on that list. This is a yearly stipend, right? This is $350 to $426, the heating season.
That's the heating season, and of course, New York State makes their plan well before we see this large increase in prices.
We sort of interrupted here and started going back and forth from social services repetitive to you with HEAP. Do you have anything else to add about HEAP, or did you get it all to the?
Well, I think Joe was supposed to do some more.
I'd have some additional statistics for you, not relating to heat, but relating to some other areas.
Anything else on HEAP that you want to bring forward?
Only if I can assist.
Not that you want to, feel like Joe, do, whatever. Yeah, that's fine. And Joe, come right up front.
So, not in the agenda packet with the other statistics, but I think we each have some charts in front of you, some bar charts that look kind of like this. We have the line graph, and then the other one that goes with it for some hard data. I compiled this for you for 3 different areas relating to CPS, just because I want to share this with you. And the reason I'm doing this is I want to see where we are versus the rest of the state, where we are versus other North Country counties, and what our trends are. So the first chart I'd like to take a look at with you. Am I not looking? Do you use the microphone?
We're good.
I'm good. Is the percentage of workers with more than 15 CPS investigations. Really what I would like to look at is the graph itself. The other page that comes with it is just kind of the hard data. If you're into numbers, that's something you can definitely take a look at. So I went back to January of 2021 and pulled the data from the state regarding the percentage of workers that each county has with more than 15% investigations. So the percentage of workers that they have that have such an increased workload. At that time, St. Lawrence County, we were up above, we were at 84%. The state average at the time was 26.7%. Now, if you look at the dotted line, that's our trend over the last year and a half, and that is definitely coming down. And that is attributed to the hard work that our staff have been putting in trying to get people on board to spread out the workload a little bit and to close out some of these old cases to bring their workloads down. So again, I included data for St. Lawrence, Jefferson, Franklin, and Lewis counties. Lewis County is always kind of an outlier because they have such a small staff. They get 1 or 2 new cases, and that's huge for them. That's good percentages all over the place. But because they're a North Country county, I did want to include that in there for your, just for your viewing pleasure. But But really where we are in terms of the state average, we still have some work to do there. But I want to show that we are definitely trending in the right direction, as that dotted blue line will show. It's been a steady trend over the last year and a half, and we're going to continue to move in that direction to get us where we need to be. Again, I'm giving you this data as points of comparison, so you all get a better feel of where we have been and where we're going now. And I think that's the important part. Knowing that we're moving in the right direction and we're kind of steering the ship to where we can be more in line with the state average. And my goal, I tend to be rather competitive. I want us to be better than the state average. So, does anybody have any questions on that first chart? Yes, ma'am.
Thank you. Maybe I missed this. The numbers under the month and year are ranked.
That's a percent.
Oh, that's a percent.
Yeah, they have a
Okay.
percentage of workers we have. So for March 28, 68% of our caseworkers have more than 15. So, and this is kind of an interesting number because it's very easily affected by staff turnover. We have one staff member leave that has 15, 16, 17 cases. Those cases are open and they decide to leave without closing them. Well, those cases all dumped off onto somebody else, and that jumps their numbers up. So these numbers can skew very quickly and very rapidly based on staff turnover. If we have a staff member that wants to go to another county, that wants to go to another department within St. Lawrence County, that just wants to get out of the business altogether, somebody else's workload is going to have to increase to take that. So, and that's why I think it's important to take a long-term look at it as opposed to a month-by-month snapshot, because month-by-month things can change in either direction very quickly based on simple staff turnover, based on we got 3 staff members coming out of training, they're already ready to take on full caseloads, and that kind of, smooths that number out for everybody else a little bit. So that's kind of where I want to go back to the beginning of 2021. So now we're, a year and, well, not quite a year and a half into it from there, but we're starting to see a larger snapshot in terms of what our trend actually is. And while we're not where I personally would like it to be, the staff have been doing a tremendous job in getting those cases closed and getting the workload down. So we are trending in the right direction. Sir, question, Mr. Burger.
So this talks about percentage. What it doesn't show are how much higher above the 15 are we, and how that compares with the other. I mean, if that 68% is way above 15, then that data point might be relevant.
That is an aggregate score based on all of our caseworkers. And you are absolutely correct. We could have a couple of new trainee caseworkers that are under 15, but we have a couple of people that have 30 because they're the senior workers and other people that they got dumped on. So what we're hoping for is when we're getting these positions to go, we're getting these people through training to smooth that out and reduce everybody's workload and reduce burnout. And if we reduce burnout, we reduce the turnover, then those numbers are all going to come down. So that's kind of what we're working towards.
Any creative ideas as to how we're going to get better in 3 months, 6 months?
So we have a plan that we're working on. I met with Ms. Rand and our grade A supervisor, our respective members this morning regarding this. We have a couple of grade A or senior workers, I should say, that are doing nothing but working on getting some of these old investigations down. And that's we'll be talking more about that in one of the other charts as well. I think that's going to help us to get some of the older cases closed. If we can do that, the rate is going to keep up with the new cases. And at the same time, work on our staff turnover issue. That'll bring those numbers down. I've been here, I think, 5-6 weeks now. And in that time, I have seen the change in staff morale. I have seen more smiles on people's faces. I'm actively working with our staff every week in our staff meetings to talk about self-care, to talk about communication, to work on those issues, to try and create an environment where people want to stay. Most people don't leave the job because of pay. The studies show they leave the job because they don't like the supervisor, or they don't like their environment. And those are two things that I actually have a little bit of control over, I think. So I want to create an environment that is conducive to our staff. And I'm not saying it wasn't before, But we're trying to be creative and find ways to improve the work experience for everybody and try to attack that staff turnover by increasing our retention numbers. That's the long-winded version of saying what we're doing.
So. Other questions? Go ahead.
Thank you, Mr. Chair. When I look at this, I think year over year, from 21 to now, our number of increase in case. How many have we gained? I know we have several.
I'd have to get that data for you, ma'am. I don't have it right in front of me.
Okay, I don't need to.
No, you're fine. I'll get that for you. I just don't have it right here. I don't want to speak to something that I think may be wrong later. And I do that on my own.
Appreciate it. Thank you.
All right, so the next chart, that in your packet speaks a little bit to what we were just talking about, that's percentage of overdue investigations. And there's something that I would like to point out here. So if you look at the percentage of overdue investigations, the trend line over the last year and a half is going in what appears to be the wrong direction. But if you go back to August of 2021, if I were to run the trend just from August of 2021 until now, it's actually trending in the right direction. So what happened is along the line, August, somewhere in that vicinity, things turned around. Things started working better for us and we're moving in the right direction and getting those overdue investigations closed. If I were to redo this chart and get these statistics for you from it, because I did do that, I just didn't include it in the packet, just out of my own curiosity. If I did it from October 20 or August 21st forward, our trend would be going in the opposite direction. So I don't want to be misled by the uptick in that trend line because it is actually moving in the right direction. And part of that is the efforts of our CPS unit. As I said a moment ago, we have 2 senior workers. All they're doing right now is working on getting these overdue investigations closed. There's a lot of factors that go into an investigation not being able to be closed. Figures touched on it earlier, issues with the courts, kind of dragging things out. There's any number of things that can lead to that. But we have a plan and we are working on it. And again, I would like to point out that from August 21st forward, the trend is actually going in a positive direction for us to try and get this taken care of.
Great.
So it is encouraging. We approved 20 new positions. And so I'm glad to hear there's only 5 openings now. So that means we're plus 15.
Sir.
So that's good. I do know from conversations, some people that are working like on adult cases, that those individuals feel that they contribute more, that maybe there's availability that they could actually do some of this work too. The other thing in our chart with the North Country, Lewis County is kind of an outlier.
Yes, they are pretty much everywhere.
So the Lewis has a huge Mennonite community, and the majority of those homes are 2-person, husband and wife or partners or whatever in there. And so, and the other thing is that St. Lawrence County is the poorest county, second only to the Bronx. So I would be interested in finding out how many cases per 100,000 people that we have versus some of these others, whatever the state average is. It doesn't have any effect on the percentage of workers with more than 15 CPS or investigations. That means we need more people, but I think that you'll find that our cases per 100,000 will be higher than most if it's truly poverty and drug related. We know that I think we lead the state in methadone around in the state. So you have all those factors. I mean, if you just put St. Lawrence County versus Westchester, a very rich county, it would look black and white here type thing. So
if anybody's interested, I have a binder that I'm keeping in the office, and I'd be glad to get copies for you. I actually have hard data from every single county, so I can get that information for you.
because I think in our numbers where we jumped from, say, like a couple hundred kids to 300 kids, I would believe that the statistics would show that these are primarily drug arrest of parent or whoever,
I can't say one way or another with that,
Understand.
but I understand exactly what you're saying on that.
I'm happy that you monitor this and we're making progress.
We are making progress, and again, as I said, we actually met this morning after our staff meeting, and this was our topic of the day.
Well. Moving right along.
The final chart is percentage of timely safety assessments. Going back to January of 2021, a year and a half ago, almost, 74% of our safety assessments were done on a time limit. It was 26% were not. If you look at the trend line, we are constantly moving in the right direction. We are now at 96%. We are one of the leaders in the state, which is tremendous work by Ms. Rand and Ms. Demers and her staff. We're 96% is awesome. We're going to try 97% next month, 98% after that. I told the story in staff meeting today that I got a 98 in my science class in my 8th grade. And I was so proud. My dad stopped and said, "Mom, was a 99." So we're at 96%. I think that's a tremendous achievement by our staff, but we're going to continue to try to push to be better on that. Now, there are factors that come into here as to why safety assessments can be delayed. For example, you only have a certain amount of time to do that. If a parent takes a kid with them on vacation to Florida, and we cannot take that face to face or that contact, then that's going to be delayed. So, is in a perfect world, it would be zero. Will it be zero? I'm hoping. Will it always be zero? Probably not, because it's not a perfect world. We're going to work towards having 0 cases that are not done in that timely manner, and that we are at that 100% mark. That's our goal, and that's what we're achieving. And again, you can see the trend line through the hard work of, like I said, Ms. Rand and our supervisors there. They have done a yeoman's job in turning that around for us.
Any questions? What's up?
John, flip side of the equation, what's the target goal for the first two? 0 or?
I'm sorry, what?
What's the goal, the target goal for the first two? We want to be 0.
Oh, yeah.
Our state average, you want to go lower?
Oh, I want to be lower. So I've said this every place I've worked, and it's something that I've always strived for, and some of the times I've made it, sometimes I haven't. My goal a year from now is to be the county that other counties send their staff members to learn how to do it. My goal is for St. Lawrence County to be the model county, and we have a lot of work to do. We will always have a lot of work to do. I don't care what these numbers say. I don't care where we are, what our trend lines are. We can get 99%, and I'm going to sit in front of you and tell you you have a lot of work to do, because we can always improve. We are shepherds of taxpayer dollars. We are providing services to the people that are most in need in our communities. It's incumbent on us to not stress our work. 96% is great. It's not good enough. Where we stand and going in the right direction in our other 2 metrics we talked about. It's great. We're moving it. It's not good enough. It will never be good enough. We will continue to work.
Anyone else? Go unleash you here. Thank you very much.
I do
Very
appreciate it.
informative and very welcome. Thank you. Okay. Moving along, vacancy review committee, Mrs. Schwartz.
So the first group up, I'll just remind you briefly, with vacancy review, we have brought 15 this month. So on this agenda, we have Social Services Office for the Aging and the Youth Bureau. The numbers that I held for you, I received at the beginning of May, so those still hold for related committees. There were approximately 80 vacancies coming into May, and we're at about a 90% fill rate immediately. So we're seeing those, that 30-day, that next tier down is at about 6%, and there is a variation between the two of 4% of held and withdrawn. So just keeping in line with the numbers I like to provide to you. But there are 2 positions up for social services. So I'll have Mr. Siebert go over case supervisor first. Go.
Thank you, ma'am. The first position is our grade E case supervisor in our child protective services unit. We would like to fill this position. It dovetails in us with what we just talked about in terms of statistics. we need to fill these positions to make sure that we keep moving in the right direction. We can't afford to backslide on any of our efforts right now in terms of making sure these cases get closed out and get addressed in a timely manner. And by filling this position, we're going to help alleviate some of that excess workload we just illustrated in that chart we talked about with percentage over 15, which is the recommended state threshold for number of cases we should have. So with that in mind, I'm recommending or requesting that we do fill this position.
I could, Mr. Chair. This position is good news for the county in that we got to maintain one of our talented supervisors. The board was supportive of recreating the medical services supervisor, if you remember, a few months back. And so that is a position that we've restored that hadn't been in place for probably over a decade. And that person, fortunately, also has worked for the county for a number of years, so is very well acquainted with our processes, worked in these units for a number of years. So I think it's certainly a good one because now I think the downside of that is we have to replace the supervisor over the units. Yes. So it's certainly something we're grateful to the board for having supported. We do believe with the changes in Medicaid, it's going to be very helpful to have someone who can work with the state to interpret those policies, but in turn that creates this vacancy. Questions for Joe? Okay, next one, Joe.
Okay, the next one is our keyboard specialist. So we are expanding our services out in our Augsburg office. We're moving a number of staff members out there. That's going to generate a need for an additional keyboard specialist there. This position particularly is working with our child welfare units and is necessary to keep the workflow moving out there and indirectly will help us keep those adoptions moving that we talked about earlier. The lack of that keyboard person out there will mean additional work for the existing clerical staff. And they have done an incredible job in getting the packets ready for us to have the number of adoptions that we are having this month and that we're going to have next month. We have waiting in the wings. So I would like to request that we fill this position to continue to work on getting these kids out of care. And this position will directly assist us in that regard.
No question.
Thank you, Joe.
Thank you.
Unit. Our next department to speak with is Office for the Aging. Andrea is online with us. Hi, Andrea.
Good evening, everyone. Can you hear me?
Yeah.
Okay. All right. So this position is a create and fill for a program coordinator. So since COVID began in March 2020, I think as I've mentioned in past meetings, we've experienced about a 40-45% increase in demand for our services. So we've really noticed our staff struggling to keep up with the incredibly large call volume, the number of people that frankly should have called us years ago asking for information programs and services. So our program coordinators are our case managers. Currently, I only have 3. And that is to cover the 25,000 seniors that are in St. Lawrence County. So we are looking to add an additional program coordinator that would work within our New York Connects program. So that's our entry point when someone says, I need, and they call the Office for the Aging. You first speak with one of our New York Connects coordinators, as well as to provide some additional support to our HICAP program, which is our Medicare counselor. We also only have 1 staff member in that program, serving an incredibly large population of seniors about a very complicated topic, which is Medicare.
Questions or comments? Seeing none.
Next one.
So the next one is a position that we have not had in quite a few years. It's a senior program coordinator. So what the goal would be of this position would be to oversee all of our program coordinators, ensuring that we're meeting all of our reporting guidelines, all of the state and federal requirements that we need to, as well as cross training. We really believe in highly cross training all of our staff members, so that they would be doing case management services, in particular shelter, looking at some of we got really good at providing the basics, and we are really good at that during COVID, but now it's time to think next step. We need to be doing more enhancement services for our seniors to help them age in place. Yes, providing them food, shelter, those types of services, of course, are the core, but we need to do better and more at our health promotion, respite, the things that are really going to make the difference in the quality of life of our seniors. And this position will help give us the bandwidth to do that.
Questions or comments?
Thank you, Andrea.
Thank you so much. Have a great night.
And our last department on this evening is the youth interns for the Youth Bureau. Hi, Alexa.
Hi, good evening, everyone.
Go right ahead.
So we're submitting a vacancy authorization for our summer youth interns. And we are planning on hiring approximately 4 summer youth interns for approximately 6 weeks this summer. They would be starting around July 11th and with us through the end of August. And we're looking for these youth to be involved with a few various activities, which would consist of adding content for our youth ambassador high school programs, supporting summer school district summer programs, developing social media content and messages, writing newspaper articles, and providing support to other departments as requested. And these positions are seasonal and they are 100% reimbursed by youth advocacy funds.
Questions or comments? Changing. Thank you, Alexa.
Thank you, Alexa.
Thank you.
Moving on now to the county administrator's report, and we started off with a resolution transferring appropriations from 2021 to 2022 to complete final disbursements to the Bonadeo Group and modifying the 2022 budget for the Department of Social Services. By Mr. Burke, seconded by Ms. Yap.
Thank you. So this resolution comes before you to provide the funding in the current calendar year. If you recall, as it mentions in the resolution 315, 2021, authorized the full amount. And I want to emphasize that that amount has not changed, but with the year ending and beginning 2022, it's necessary to pull those funds out of fund balance into the 2022 budget so that we can pay them. Often what we'll do is provide language in resolutions that identify that any remaining appropriations be rolled over. And that is one way in certain circumstances that we address the same issue. So it doesn't often happen that we need to. And in this case, we need to move the $63,750. $21,250 has been paid to Bonadeo for that first report. We've now received the second report in April, and the final report will come to you in June. And after that report's received and reviewed with the board, we'll make our final payment. Questions?
You want to say too that this will close out 2021?
Yes.
So we should have 2021 finalized.
Finance.
Or finance?
Well, prior to our auditors coming.
Okay. All right. Any questions? Right along, committee reports, unless you have something else.
Can you take a vote, sir?
All in favor?
Aye.
Opposed? Carried.
No,
I got forewarned at the start of this meeting, to try and beat somebody's record. I mean, I haven't succeeded.
No,
I'm not
clearly.
going to.
And I would disappoint you if I didn't have a few other updates.
Getting ahead of that.
Okay, so I wanted to mention to you, as required by local law of C of the year 2011, I have a transfer of funds to report out to you for $1,125 in the county treasurer's office. This is a cleanup for the county clerk with regard to postage and postage lease equipment. So that is to help close out 2021 as well. Just in keeping with what we've been seeing recently, I'll give you a short COVID update. The remote attendance has been extended. You received communication today by Governor Hochul late last week. So that will go through June 14th. I do have vaccination rates updated for you countywide. We have 61.2%, and the 5+ population, is at 64.4%. We are currently holding clinics in the public health department on Mondays and Thursdays. Mostly what public health is seeing is the second booster for the population coming in to receive those vaccinations. They've seen less than 10 for first doses in May. So they really have seen a shift there. Case count currently, we're seeing about 63 cases per day. The positivity rate is 5.8%. For the state, it's 7.1%. We have seen since last Monday a reduction for a period of time. The last few reports I've given, we've been in the high COVID community level. We've been reduced down from high to medium. And we also, just by way of update, you may get questions, still have approximately just under 13,000 tests available here at the county. When you came in the door, you probably saw there's a table there with tests available to take. Please let folks know if they're looking for tests to give us a call. Also, the Chamber of Commerce has an inventory of tests to share as well. As you've heard, and ours are no exception, we do see those with expiration dates. We're reviewing the information provided from the Department of Health to make sure if there's been an extension of 3 or 6 months for certain lot numbers, that folks know how to find that information. That's the extent. We also still have some hand sanitizer available for you as well. Just real quickly, wanted to let you know we did host the first graders. I shared some photos with you last week from Canton School District and Banford Elementary. They enjoyed, we had over 2 days, the first grade classes come in and meet with us. They had an opportunity to visit with the court officers, as well as certainly our Sheriff Bigworth, who is able to show them lots of functions of the Sheriff's Office. This Thursday, we'll be having our annual review for health insurance with Burnham, our consultant, as well as Excelis. And this is an area certainly we'll be paying very close attention to, as we're seeing those costs probably hitting our budget as one of the biggest expenses. Our efforts continue. I think you heard Jay speak to it tonight from a staffing perspective, but staff in the correctional facility as well as in the department are working on that medical assisted therapy, or the MAT as we've become familiar with. They've delayed the start of it to the fall from February. Our hope is to be prepared well ahead of that deadline, so that those services can be provided. As you heard, one of the biggest hurdles right now is staffing. And so there's a hesitance to move nursing staff into those positions necessary to get policy, procedure, and practice ready when we don't have the existing clinic services served by nurses. But that's something that's well on its way to getting organized. If you'd like to attend a meeting, you're certainly welcome to. Those are held by Zoom. I can get you the information. In Board of Legislators news, I wanted just to let you know, see our IT manager here, our director here tonight, sitting in. Dylan's traveling this week, so he's here to make sure we stay online. But also we continue working on, and he hears from us regularly on the audio visual in this room with the equipment that we have, making sure wherever folks are, they can hear as well as see what's happening with the meetings held by the County Board of Legislators. We also are exploring an opportunity to move our agenda to a software component. A lot of information travels through both the voting process, also in the communication electronically, as well as for our permanent record. We have, since I started working here in 2003, used the format that you see before you tonight. And we believe there's an opportunity both to keep better records, but also to have that process move through the agenda from the 11 days out when we start preparing an agenda at the department level, all the way through to the treasurer's approval or our approval in the board office, to that pre-committee meeting. It happens 5 days out, all the way until a meeting like tonight where it sits in front of you. So you may be hearing more from us. We're looking at a few different options, and we would issue an RFP if the board is agreeable to let us go in that direction. So we're doing the research now to hopefully bring you a better product. I think, excuse me, I think what COVID has also helped us understand is that getting the information out, getting it accurate, and making sure that it's viewable online as well as in person is critical. So we're looking to improve how we do that. I did want to mention, now there's more folks joining us in the boardroom, that will make sure that your desks are cleaned out. If there is garbage in your desk, if you can leave it on the desk. Certainly if you have materials in the drawers there, we'll leave that for you. But we'll make sure that they're clean and kept up with more attendance in person these days. I did want to mention this year, if the board's agreeable, we'll plan the August board meeting to be held at the St. Lawrence County Fair. As we've done, except for COVID, we've done 3 times. This would be on August 1st. So I just wanted to mention to you ahead of time, Also, if possible, being that the board may be changing come the end of 2022, we'd like to get a photograph of this Board of Legislators all together, and we'd like to do that at the July board meeting. So rest assured, I'll remind you several more times before we get to that day. We'd like to have a proper photograph. We'd like to include that with our proceedings, as well as we'd like to have a framed picture in the board office. And that's all I have right now, unless there's questions.
Any questions? Mr. Burke?
I don't know if this is appropriate now or under, when Jake talked about being 3 nurses short. What are we gonna do about that? How are we, and public health, I think, was down 3 as well. Do you ever explore taking people, benefits like that they want some days? Be allowed to do that?
I think that's a better question. I think we've looked at a number of potential solutions. Up to this point, we haven't been able to put any of those in place. So I think we learned that at NISAC Finance School, and certainly you're seeing in those legislative updates, the state's taking a little bit more forward mobility toward incentivizing financially. And we'll be talking to you more about that. They're putting some frontline healthcare worker funds out there, but that's going to be across the board in the state. So I think that it is a challenge for us. We have looked at the numbers. I was actually, as the meeting was continuing, talking with Jay a little bit more about those positions, looking at the list that I have. The combination is filling the positions in the clinic. I think there's 2 CD counselors and a mental health counselor, and the rest are new positions for a program that hasn't started yet. So figuring out how we attract folks to a new program that have reasonably desirable office hour type setup rather than shift work is something that we have to talk more about. And also, I think one of the things I did want to mention is I've organized a small group. I did talk with you a little bit about it. We met late February about workforce improvement efforts and talking more about that, figuring out how we strategize a little bit better for attracting folks to come to work here. The student loan forgiveness program, there's a few different ways we need to look at what we're putting out there to make working here more attractive. But the work experience, I think getting folks in early, being able to work with our universities, we talked about those internships being really important early on. Also having human resources, they just attended the Messina job fair, but getting a better conversation out in the public about what these jobs are. It's very unattractive in a lot of circumstances when the advertisement for the job says it's provisional, you have to take a test and you have to score the top 3. There's all these reasons why it wouldn't be an ideal place to work. And right now we know we're behind already because it's an employee's market, right? You could, and one of the articles I was reading over the weekend talked about folks accepting positions now. The most recent crisis is they accept positions, they do all their paperwork, comes the first day to show up, they don't come. So I think there's a lot happening, not just in St. Lawrence County government, but certainly to provide our services, we need to re-strategize how we do that. I appreciate the question.
Questions? No questions.
Yes, sir.
Committee reports, Board of Health, Mr. Akers.
So the Board of Health will be meeting tomorrow night at 6 o'clock on Zoom. I did come across an article just recently about natural immunity. A study was done by the CDC. It shows around 75% of American children and nearly 60% of adults have already had COVID. It was a large national survey. And to give you a comparison, a small survey done in Santa Clara back in April of 2020 showed that 3% of the population had COVID. So in February of 2022, the CDC shows that at least 58% of Americans have had COVID, as evidenced by their anti-nuclear capsid antibodies, which are produced due to infections, not by the actual vaccines. I try and give blood every 8 weeks. And so I called and I was a high positive, but they don't determine whether it's from the vaccine or actually from infection. And so still curious how to find that out. But the article goes on to say that if 75% of Americans' children have been exposed to COVID, the questions about the need for the vaccination, because the risk for children and young adults are fairly small. they're smaller than motor vehicle accidents, drowning, homicide, suicide, drug overdoses, and cancer. So this information I'll be bringing to public health meeting tomorrow night. Thank you.
Mr. Sheridan, the CDP Board of Directors.
Mr. Chairman, the CDP Advisory Board, their May 11th meeting was canceled due to scheduling conflicts. And they're going to be meeting again on June 8th.
The Community Services Board. Okay.
Thank you, Mr. Chair. We met on May 3rd. We had a very interesting presentation about the Lincoln School in Ogdensburg that's been converted to apartments for people that either have mental health issues or other sorts of issues, and that will be opening soon. And I had asked the person who gave the presentation if I could get the presentation and distribute it, because I thought it was very interesting, and I think you'd all enjoy seeing that. Our next meeting is on June 7th, and Mr. Chair, if you would indulge me, have a quick update from the chamber as well. May I do that? Thank you. So important. I know. On May 25th, the tourism dinner is taking place at Pickens Hall in Hubleton. It starts at 4:30, the tours, 5 o'clock happy hour, and a 6 p.m. dinner awards and presentation. You sign up for that on their website, the Chamber's website, and I was asked to tell everybody to please come. I'll be there. Thank you.
Office for the Aging Advisory Board, Mr. Denisha.
Mr. Chairman, I don't have much reports since the last report, but our next meeting will be Tuesday, June 14th. Moving from a Monday to a Tuesday, because the Tuesday seems to be better than most folks. And the Office of the Aging has been distributing COVID test kits with the home delivery.
The Youth Advisory Board, Mr. O'Malley.
Thank you, Mr. Chairman. We had our last youth committee meeting on May 26th, and just some updates. Our artwork and video campaign contest for our St. Lawrence County Teen Sextortion and Suicide Awareness Prevention Campaign. The due date for those materials is on May 20th. We're looking for information for our June newsletter. Items are due on May 31st. Some of the highlights in that hopefully will be an interview with Andrea Montgomery in the Office for the Aging, looking at suicide prevention in our older adults, as well as Matt Denner and the EMS volunteer shortage, and how maybe we can reach out to the youth in our community to get them on board for that. They'll also be highlighting summer jobs and some seniors, some high school seniors around the county. I wanted to give an update on the trash dash that we held on April 30th and May 1st. Between the 5 locations that were where we had participants, 821.37 pounds of garbage. And in our partnership to siphon out the tobacco products in that, 95.52 pounds of tobacco out of that total. We've got a couple of teen-led workshops coming up. One is reducing the stigma associated with mental illness, and we have 5 of our youth ambassadors that are currently going through a training process to lead that workshop. And then we had 22 people that attended the Reducing Political Polarization workshop that happened just a couple weeks ago. As Alexa mentioned, we have 4 summer interns coming through if the board approves that at the full committee meeting or full board meeting. One of our youth ambassadors, Joni Shaw, is going to participate and compete for the Miss Teen New York competition. And I wanted to share that she has a GoFundMe. One of the requirements is to collect a registration fee. And so she has a GoFundMe up, and I'm sure that you could find information on our Youth Advisory Board webpage. And then the last thing I wanted to share, WPBS has been approved for the grant that we thought that they weren't approved for, but they are. And in this grant, they're partnering with the St. Lawrence County Youth Bureau. And one of the activities that they're doing is there's a documentary coming out called Hiding in Plain Sight, and it'll be coming out towards the end of June. But they'll be doing a preview event. The Youth Advisory Board and the Youth Bureau will be hosting a viewing and panel event at Hubleton High School on June 21st at 7 p.m. There'll be some of our youth ambassadors, some of our community and health service folks, as well as some parents and some other adults on that panel. So we invite you to join them at Hubleton for the viewing of that Hiding in Plain Sight documentary. And our next meeting is on the 26th of May for the Youth Committee and for the Youth Committee. Yes, there we go.
Questions or comments? Seeing none, we'll let you go right into the family court committee.
Sure thing, and I'll keep this one short. Our last meeting was last Monday on May 9th. We are going to move to most likely quarterly meetings. We kind of closed out the business of our first priority of assessing the need for a second family court judge, and we've made the determination that right now that's not the appropriate course of action. But there are a couple of metrics that we're going to continue to monitor, which are the number of cases that we have going through and the amount of time that these cases are taking to go through the system. But most importantly, we're monitoring the adoption packets that are moving through. And as was mentioned earlier by Ms. Rand, on Thursday, we are proud to be hosting an adoption event. We have 10 adoptions going through, the two that are coming up in June, and we will continue to meet quarterly to monitor those statistics and numbers and bring information and recommendation to the board.
Any questions? Comments? See none. Thank you, Nicole. Move into old or new business. Is there any old business? Mr. Forsythe.
Could we get the committee report on the city, where we stand with the city?
Or what? City, shall we say
And
what?
committee with the city before we.
Shea roller?
Yeah.
Oh, okay. Well, so let's, I think I told you this already. Three of us met with Andrea Smith, Victoria Place, took some photographs. I left them out here for people to look at. There really didn't seem to be a lot of interest in looking at them. But I think it's important that you see the condition that that place is in, and regardless of how you see it, and take that into consideration when you're making a decision. If it ever comes to a decision that we are going to assist the city financially in cleaning that place up. Now, that would have gone a long way, perhaps tonight, with Andrea Smith, had she been allowed to be here. But I got to say that she's certainly a very good representative of the city. She's a pleasure to deal with. And as I've said before, beats that snot out of what we've dealt with before. Excuse my French. So, that being said, we are just sort of in a position where this committee could meet and make a decision on whether or not we are going to recommend to the board to do something or to not do something. So, I get some time for everybody to be here. I will set a date and time and we'll do that.
Okay. We will look at it for finance, or whatever. I'll make myself available. All right. That's the best way to do it. Let's see the committee come up with it. Okay.
Any other old business? New business? Seeing none, we have need for executive session for
for litigation, for personnel, which is the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, and appointment.
Is there a motion to go to executive session? Mr. Smithers, second by Mr. Sheridan, all in favor? Aye. Opposed? Carried.